My name is Emmerson Pollard. My pronouns are she, her. I am also a Master's of Public Health candidate at the University of Victoria, and I completed my practicum placement with Island Health, Population and Public Health. My project is titled For Youth with Youth, a framework for youth engagement at Cowichan Youth Health Centre. I would like to give special thanks to Kathy Easton, my supervisor, as well as Anita Broussard, Catherine Burgess, Megan Henderson, Dr. Victoria Barr, and the staff at Cowichan Valley School District for providing support and sharing their expertise. With respect, I would like to acknowledge that I am joining you today from the traditional and unceded territories of the Nanaimo First People. I have been privileged to live, learn, and work on these lands as an uninvited guest. I would also like to acknowledge the traditional territory of the 7 nations that form Cowichan tribes, whose land my practicum project will take place on. For my practicum project, I composed a youth engagement framework for the Cowichan Youth Health Centre in the Cowichan Valley. The framework is divided into 2 sections and contains 6 strategies that can be used to engage youth across the development and implementation stages of the health centre. The framework is grounded in evidence-based literature, and the engagement initiatives were informed by the ethical youth engagement guidelines set out by the First Nations Child and Family Caring Society and the Centre for Indigenous Policy and Research. Just to give you a little bit of background, in 2015, Island Health began opening wellness centers across the island. These centers aim to promote health and wellness in youth by providing accessible youth-specific services. The Cowichan Youth Health Center will open in 2024 after the opening of Cowichan Secondary School in the Cowichan Valley. The center will aim to serve youth 13 to 24 and will provide core public health services and eventually expand to include other health and wellness services. Embedding health centers in or around secondary schools addresses unique barriers that youth face in healthcare delivery, such as transportation, facing limited hours of operation, and experiencing limited levels of comfort accessing care. School health centers also provide upstream healthcare initiatives that promote a holistic model of wellness while preventing the development of mental and physical conditions. These health promotion goals are key to facilitating positive educational and professional outcomes for youth. For example, increased school attendance and academic achievement are cited as positive outcomes for school health centers. So why engage youth? Within health centers, youth engagement typically includes the participation in developing programming. During these activities, youth typically also have the opportunity to improve their own levels of health literacy. Youth engagement is also linked to an increase in motivation, sense of belonging, meaningful involvement, and supportive relationship building. Youth engagement can also empower youth by providing them with an avenue to develop professional skills by following their time or sitting on advisory panels. So going back to the framework that I developed, the purpose of my project was to invite youth in the Cowichan Valley to collaborate on the planning and implementation of Cowichan Youth Health Centre, to foster respect, empowerment, and efficacy between youth and Island Health, to ensure that Island Health is providing relevant services and is meeting the unique mental, physical, and sexual health needs experienced by youth, and to create an engagement framework that can be used in future-based school-based health centers within the Island Health region. In developing the youth engagement framework for the Cowichan Youth Health Centre, I first completed a narrative literature review of peer-reviewed journal articles, gray literature, and reviewed various databases and information on public health programming. I also reviewed historic documents from the Belmont and John Barsby Youth Wellness Centres and completed a brief environmental scan of youth health initiatives in other health authorities. Throughout the process, I consulted with members of Island Health, Population, and Public Health and worked alongside members of the school district to incorporate their feedback. Based on the review I completed, I outlined 4 central principles that will guide youth engagement. The first is to create meaningful engagement for youth. Under this principle, youth are seen as experts in their own experience, health, and wellness, and it should be made evident that their contributions are valued. The second is to foster a pathway for youth to build a sense of belonging and self-efficacy. Under this principle, we must leave space for youth-driven perspectives, provide multiple avenues for participation, celebrate successes with youth, provide education to foster informed decision-making, and utilize trauma-informed approaches. The third is to create a youth-friendly environment. Under this principle, involvement should be accessible by allowing youth to participate during school time. Communication with youth should occur using relevant channels. Youth should be allowed to engage freely, and adult support should be available as needed. And the physical environment should also be welcoming for youth. The fourth and final principle is to foster reciprocal partnerships with youth. Under this principle, we should engage in shared decision-making and build trust by being honest and consistent. Youth should not feel pressured to participate, and proper incentivization should be provided. As previously mentioned, the framework itself is divided into two parts. Part one of the Youth Engagement Framework aims to engage youth in the development and implementation stages of the Cowichan Youth Health Center. In part one, I have proposed 4 potential engagement strategies, which involve creating student advisory groups, hosting wellness events, offering health center tours, and running an art feature where students can submit art to be displayed at the center. These strategies are developed to capture youth voice regarding implementation and programming, to generate youth-led awareness, to increase the uptake of services, and to foster partnerships between the Cowichan Valley School District, Island Health, and youth living within the Cowichan Valley. Part 2 of the framework will serve as a bit of a basis for a program evaluation through the use of 2 engagement surveys. The purpose of these surveys will be to collect pre- and post-implementation data. One survey would be administered to students before the youth center opens, and the other will be administered after the center is opening and running. The surveys were adapted from the Belmont evaluation surveys and ask youth about their present healthcare needs, their comfort level accessing care, and their suggestions for the youth health center. Based on the results, Island Health can assess what is and is not working and address barriers to access and care. The results will also serve as a baseline measure and a point of comparison with other wellness centers. Working with youth requires special considerations to ensure that we are facilitating safe working relationships and participation. As part of my framework, I have highlighted some key recommendations regarding recruitment and ethics. First, a key challenge in youth engagement is recruiting young people to participate in activities and continuing to maintain that commitment. To attract potential participants, recruitment strategies should be brief, the content should be relevant, and communication should occur using relevant and accessible channels such as social media posts, classroom presentations, and advertisement posters. For example, online data collection methods are gaining popularity due to their flexible, quick, and accessible nature, but this requires students to have access to technology. It's also essential to develop specific recruitment strategies to ensure the voices of youth potentially experiencing marginalization are also included. In the past, these strategies have included regularly visiting alternative programs to speak with youth and working with youth on a one-to-one basis. Extra precautions should also be exercised to ensure that youth engagement is ethical and safe. For example, youth should be recognized as experts in their own health and well-being. Youth engagement should be culturally safe and trauma-informed. Youth engagement should not put youth in a position where they may feel emotionally, spiritually, physically, or cognitively unsafe. And incentives for participation should not be so attractive that they induce or coerce participation. So what happens next? My framework has been provided to both Island Health and school district members working on Cowichan Youth Health Center. Island Health and the school district will be working to implement this framework over the next year, though implementation will depend on the capacity of the team and the engagement with community partners. When I joined this project, Island Health was still in the early stages of planning, and due to ethical and time limitations on my practicum placement, I was not able to directly engage with youth or with community partners. Island Health is currently starting the process of completing community-wide engagement with partners such as Cowichan Tribes, local nonprofits, the Ministry of Child and Family Development, and youth themselves who are attending the current school called Cowichan Secondary School. This framework is highly iterative and will serve as more of a living document for Island Health and the Cowichan Valley School District as they engage with the community and with youth. Through working in partnership with local organizations and youth, we can ensure that services are relevant, applicable, accessible, and safe. What's exciting about this particular framework is it can also be used at Island Health in other youth health centers or other projects that include youth engagement. Thank you.